Hi, this is Dr. Scott, and today we're going to talk a little bit about something pretty interesting. It's called masks. As a person who I started in a university hospital in Denver, the very first time I really had an experience with a mask was this is God, 1990, I think it was 1991. And I'd never had masks on for any particular reason. And so I had near the end of what's called, you have this internship. And then at the time, you would have the called the CFY, Clinical Fellowship Year. It's kind of like a residency in essence. But the internship is a 3 month long thing. Now, audiologists today have basically the same idea when they go through their doctoral program. Well, I had been through my master's program. So I'm working that 3 months in Denver, and near the end of it, we started to, they started to say, okay, let's give you some cool experiences you've never done. So I would work on the burn unit. And this was really difficult because you're trying to test a person's hearing and you don't have the headphones with the nice sound booth and all the other stuff around you. You have a person who is in incredible pain. I mean, they're morphined up like nobody's business. These people, I mean, I remember several of them that I was testing, and I would lay the headphone by their ear, not touching them because their ear was actually burned as well, many of them. And they would, raise their finger as they heard the sound. And then I would talk to that physician who was on the unit and saying, listen, I think that we're causing more hearing loss by the medication. Can we back it down? And the physician, he or she was always sitting there going, dude, I don't think so because we're trying to keep him alive. And at first I thought, well, wait a second, why would you want to turn it down? And I realized, okay, come on, Scott, there's more things you don't know than you do know at this time, right? I'm just the intern kid that they didn't want to really listen to, but they had to actually look at that, and the data was actually showing it. So then I started into surgery, and they taught me, like, you have to wash your hands in this perfect way, and you come in, get gloved up, and then you would put on a mask, on and on, right? And here's why you wore the mask. And then I realized you had to like bend the little surgical mask or it'd be like pushing on your nose quite a bit. And it always caused me a lot of irritation. So we learned what we had to do. You had to take off the gloves and you have to have the mask off in the right way. It was a disposable mask. If a surgeon had to go out of the room and then she shows back up in the room, that they always put a new mask on. Now, this is the backdrop of my own information, and we show up in 2020 with this possibility of masks. Now, masks have always been nothing more than a spit shield. They always have been nothing more than that. I mean, no one has thought of them anything but a spit shield. Now, the medical masks actually have a little more stuff in there, but they're actually not the great things to breathe in because your nose needs to expel the crud from your body. So you breathe in with your nose and breathe out breathe in with your mouth, breathe out with your nose, breathe in with your mouth, and some people are mouth breathers, right? That's what I was because I had some nasal problems with that too. But that's the correct way, is breathe in with your mouth, breathe out with your nose, because you're expelling out the annoying stuff that comes in. I mean, that's the carbon dioxide, but also all the other crud in your body, right? And you're pushing out that kind of stuff. That's what we learned over and over again. But then 2020 comes on and all the rules are broken. There's a place called Quick Trip here in the Tulsa area, and it's a high-end kind of gas station. And I remember seeing the guys, because I was to get my like my purple drink. Long story with that. And they come up with their big cups, right? And there used to be the lids in the back, and I didn't understand why the guy didn't have the lid. Both of them had masks, and they're looking at one another, and he's trying to get the lid from behind with the tongs. And I'm like, wait a second, what are you doing? I don't get this. And the customer's sitting there trying to figure out how to reach for the, for the lid. I'm like, dude, just grab the stupid thing. Now they have no gloves on, which also messed me up too. If we are having there's a movie called Outbreak. If we're having, or Contagion, go watch those movies. Every single one of them had, massive masks. If you look at what BSL 3 labs are versus BSL 4 labs are versus BSL 5 labs, go look at that one. Everyone in the world is violating every single possibility for virus transmission, right? We just talk about it here, but like if you breathed on your hand and then you touched someone, you just basically put that information, put that out there, right? You put the virus into someone else. And yet, in the same circumstance, the guy reaches into his pocket, pulls out the dollar bill, touches it to the cashier there. Cashier reaches in the drawer and grabs the change, and every single banker, my father-in-law was a banker, and he would go, he taught my wife this, but he taught me this later on. Change is the dirtiest thing you can come up with. And I didn't realize it until later on. You realize how dirty change really is, especially pennies. They hold on to all that gross stuff, right? And they're touching each other's hands, and I'm going, you're breaking every transmission rule out there, right? Now, in the situation, we have non-medical people who've never ever touched a mask in their life, right? And they're trying to look at what is actually happening. So they have to look at medical professionals to tell them the truth, right? And I kept looking at this, I'm not wearing that stupid thing because it messes up my breathing habit. Let me just show you a couple interesting articles out there. And it says mask effectiveness when worn correctly. And then they get into, more myths and conversations, and they talk, whether this thing works. And I kind of go, wait a second. If you're wearing a mask, you shouldn't be getting an infection. You should be fine. Then you shouldn't need the vaccines. Oh, but if you get the vaccines, then, and I'm going to take this off the screen here for a second. But if you get the 2 vaccines, then you've been fine. So if I'm wearing the mask and the 2 vaccine, oh, okay, I'm fine. Oh no, but then you got to have the booster. And around the same time, the booster was coming out, because remember the vaccines come out in 2021. And it's time the booster's showing up, we have this conversation called asymptomatic. Let me show you what they start talking about here with asymptomatic, which is the literal dumbest statement in the history of the world. Let me pull this up here again on the screen and show you what I mean here. Sorry, it takes a second. Okay. So here's what we talk about. We see these really interesting studies, effectiveness of mask and respirator on indoor public settings, right? So we look at these kinds of studies, and this is done in December of 2021, right? So they get into these long conversations about, the different types of control studies and the way that those studies work. And this was a higher proportion of case studies was unvaccinated versus the control people. So they're saying, wait, more people who were not vaccinated were part of the outside of the study. So that actually mixes the whole study results. When they get into this kind of thing, they even talk about, asymptomatic. And I go, wait a second. What the flock does asymptomatic mean? Now, anyone in medicine points would ask the question, what does the asymptomatic conversation actually mean? It means that there's no symptoms. Wait a second. Let's give you an example. Let's say you are having pain down in your hands and in the wrist area. You might then kind of see your primary care physician, we send you over to an orthopedic guy, right? And the orthopedic guy gets in the middle of the conversation and they say, well, you have XYZ issue, right? Or you have a good DO who does a good manipulation on your hands and fixes the problem with that kind of thing. Or they want to look into surgical points, but they're always starting with a symptom, right? Or I have shoulder pain, or I've had a torn ACL. What happens with torn ACL? You have a joint area that's going to kind of blow up. When it happens blow up, that is a lot of other fluids that are coming in their blood and other kinds of things, because the body's trying to heal itself, but it's a really bad injury, right? And so you're always saying, what are the symptoms that would lead you to the particular diagnosis? This actually happens. And by the way, when you're doing something called a 1500 form, these are the insurance forms that every single paramedical, medical, or physician will ever utilize. Now, the physicians don't fill that stuff out, but you have the, other medical people around them that will do that. And so you have to actually say what your diagnosis code is. And then you have to say all the tests that you ran to come up with that exact diagnosis code. So for instance, in the audiology realm, if we were saying, well, the person had sensory neural hearing loss. So there's a V code for that. And so you go, okay, well, the code for that one. So you might look at all the different EOBs, or excuse me, the different tests that you would run through to come up with that idea. And you obviously ran those tests and they cost X number of dollars, and you have a full-on bill that you bill out to the insurance, right? This is just the process that goes on. And this thing called ICD codes, right? And they're all based upon, you would never know to do those particular tests without something called a symptom. The patient comes in with a symptom. They don't walk in and go, everything's fine. Like, if everything's fine, I'm not doing a test, right? I mean, why am I going to test your knee if everything is fine in your knee? I mean, why do I care? Are we doing a checkup because of something? No, I've never really had a problem. Well, then why would you have this issue? Do you see how ridiculous this conversation should be? We should never have had the conversation of asymptomatic. Someone was lying in this. And here's what I want you to see. Everyone that you can look at, and I'm going to show you back on the screen here again, would tell you that masks were 100% effective. And I go, okay, if they're effective, in the situation, if they're effective, then shouldn't we have a, if they were really effective, well then shoot, we wouldn't be needed, any kind of vaccine. We should never have had any spread of this. And yet they keep telling you that they're effective, but I asked this one question, and here's one of the most fascinating ones right here, and this is a little bit hard to see. But the COVID SARS device, it's in microns, 0.1 microns, okay? Whether a human hair is 100 microns, right? And so we're talking about different particle sizes, like a red blood cell or a bacterium. Bacteria is a much bigger, it says it's approximately 2 microns. Okay, but then it says, now here's part of the lie. They tell you that an N95, a surgical, level 2 surgical mask, goes down to 0.1 to 2 microns. And that's why people think that this is true. That has never been the case. A mask can do no better. Here's the real thing, because this is an actual great point here. A well-fitted mask with decent filtration, that's called an N95, does no better than maybe 2 to 8, and frankly, 8 is about the number. So you're saying 8 microns, it would cover a blood cell, which is or any type of spittle that comes out of your mouth, right? A red blood cell, spittle, kinds of things. And yet, the COVID virus is way smaller than any mask could ever be. This is part of the lie that they're not telling you. Over and over again. let's show you graphically on the screen what I'm saying here. So graphically, we're going to show you this guy. This guy does a great job with this.
Above and keep my glasses from fogging. Lo and behold, the aerosols go all around it. Has no effect on me spreading aerosols to you. Now a cloth mask I borrowed from my wife. Once again, here we go. Boom, straight through and around. It has no effect.
So if it's not stopping aerosol, what the flock is it doing? Now let me show you on another kind of area here.
When you drink bottled water, you're consuming microplastics, up to 300 microplastics every time, and up to 130,000 microplastics per year. So I'm looking into what these masks are made of, especially ones you could buy at Walmart, and a majority of them consist of recycled plastic. So what are the chances that we're inhaling microplastic all day long? Disregarding all these little fibers that are hanging off, but actual microplastics that we're inhaling directly into our lungs. Never mind, I looked it up, and yes, you are inhaling microplastics. My favorite page on the National Institute of Health. This page talks about the current standards of the masks. They also talk about ethylene oxide, which is a common sterilization agent used to disinfect medical devices. And yes, they put this stuff on your masks. And according to the EPA, long-term exposure to ethylene oxide in humans can cause irritation in the eyes, nose, throat, lungs, and damage to the brain and nervous system.
So wait a second. Now we're breathing in something really gross. And then I say to you, then we say, why do we have people wearing this? Let's show you. This is actual reactions to a mask. Watch this kind of thing. Why is the little kid breathing like that? Because she can't breathe. Look at this one. Look at the distress that comes when you mask up a person, a child who can't say, I can't wear this. You say, yo, they can breathe just fine. Are you sure about that? Then I want to show you the level of the scam, because there is a scam here. Watch this one. I'm going to kind of mute it here, but because it's not in English here. And they're still all standing around there. They don't have masks on. Oh, now we have to start putting our mask on before we get ready. Oh, let's get ready. Let's put our mask on. Everyone mask up. Oh, get your mask on. Huh. Let's show you this one. This one's even like unbelievable. Wait a second. Let's do that again. I want you, without listening to the guys, puts a little thing on there. They'll have the mask on, and they rip it off as soon as the camera goes away. Wait, what? This is when I look at the circumstance, and this is my kind of look here. Sorry, it's not perfect here. This is me going, huh? Make it make sense. Then we did this, and so here's what the kids had to deal with this stuff too. There's air underneath there. Come on. Doesn't that like make you say, wait a second? It even gets stupider when we see this. So they're not even playing, but they have this thing going into the air. What? Then people are so indoctrinated into the mask, they're in the pool with mask on. Like, what are you doing? Wearing a mask in a pool because we have nothing but indoctrination in us. Here's actually a response. This is a powerful response that you'll see.
Oh, we don't have to wear masks anymore.
Little kids are going, wait, now I don't have to wear a mask anymore. And we just are missing what we're doing to the kids around us. Now I'm going to show you a couple of videos. I couldn't load them up here easily without putting it out there.
You have a mask?
No, I don't.
I can give you one.
You can give me one?
I can give you one.
Why do
I need you to wear a mask.
So you can hand me a mask,
I can hand you one, yeah.
but you can't hand me the drink without a mask?
You've got to wear a mask.
How does that make any sense?
That's what I just need you to wear a mask. Do you mind?
Well, if you can hand me a mask, why can't you just hand me the drink?
I can hand you the mask.
So he can hand me a mask, but he can't hand me my drink. Makes perfect sense, right?
And then again, me looking at this going, okay, let me show you another one. Oops, sorry. Got to bring it up and have to bring each one of them up in their own way here. So, sorry, it takes a second to load each one of them. Oops, sorry. Pulled up the wrong one there. Sorry, it takes me a second. Because you can't load more than about 10 of them at a time with that too. I thought this was powerful. Like, even a kid's going, huh? Why am I going to do that? Now, this is actually found, I loved this one. Oops. I loved this one and what they were doing and how this was a response. And I hadn't seen anything like this in this kind of way. I'm just trying to tell you something here, guys. You're seeing a response that in the Tulsa area hospitals are pushing this mask thing to new levels. All hospitals around the country are trying to push on new concepts of the mask, and I've just shown you through the responses here.
Strip to protect above and keep.
When has an aerosol, it doesn't even protect from an aerosol. It's a spit shield at best situation that we can come up with. And even a better fitted mask that they tell you is okay and is effective for usage, it blows it out of the water over and over again. And again, I keep saying to people, make it make sense. Why do we have things that don't make sense? Because if I've worn my mask, why would I need the vaccine? Why would I need the vaccine and the masks and why would I need a COVID booster? Why would I be worried about it if it's asymptomatic? Then I couldn't even know about it. And if I've taken all the boosters, why are we seeing some people who have more and more significance to this, to the ringing in their ears? And I'm going to tell you something fascinating, just going back to this one. Now, this woman had to wear this no matter what happens. But as a person who has hearing loss, me, to other people who have hearing loss, 50 to 60% of all information comes upon the face. And I didn't even bring up this meme here, but the powerful point here that we look at, we say, wait a second, this can't make sense in any way, shape, and form. I'm going to show you this. This is a new study that was done, well, actually done about a year ago. NIH suggests that N95 masks may expose the wearers to dangerous levels of toxic compounds. Huh, you don't say. This is a physician, a surgeon. I don't know what the flock was going on in here. Not even wearing it correctly. I've seen numerous cases that people have the mask sitting around their nose. Actually, here's here's another powerful point out here too. Look at this one here. And this is just, some kids on a college campus, right? And she's wearing what? Like a wrap around her face? I mean, in Tulsa here recently, it's been like down to, 18 degrees, which is a lot colder than other places because we have more humidity, right? Or we have way more humidity, which reduces the temperature. So I'm walking up to the state capitol on Tuesday morning, and normally I just wear my leather coat, right? But I had my scarf around me, the same kind of scarf she has. I'm just breathing in so I could keep the heat in me, right? And yet that messes with the people's ability to understand. There's a lot of understanding that you miss when you don't see this. You miss communication points out here. So here's another thing I want you to realize is that we have communication that is dropped away so dramatically from people that we can't communicate. They don't want you to communicate. I go, wait a second. These masks don't work and the vaccine is causing injuries. So why are we doing all of this stuff? Again, make it make sense, because none of anything that we're talking about makes any sense. You should be asking questions of everyone around you. Why does the mask work? Why would I need a vaccine if the mask worked? Simple question that no one wants to seem to answer. And the answer is none of those things work anyway. Thanks for listening.